Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them in record time. Today, we're covering zoonotic gram-negative coccobacilli, bacteria that are acquired from animals and can cause serious infections in humans. Before we begin, think about the following. What gram-negative coccobacillus infects farmers, veterinarians, and slaughterhouse workers? Which one causes soft tissue infection in pet owners? Which one produces painful skin ulcers with regional lymphadenopathy in hunters or landscapers? Answers coming up. Zoonotic gram-negative coccobacilli have a shape that's in between round cocci and rod-shaped bacilli. Being zoonotic microbes, they're transmitted from animals to humans, often in people with occupational or environmental exposures. The diseases they cause concern not just doctors, but also veterinarians and animal health agencies. Let's start with Brucella spp. This organism is a small non-motile, facultative intracellular coccobacillus. It's oxidase and catalase positive and requires enriched media like Brucella agar to grow. It's slow growing and poses a lab-acquired infection risk, so biosafety precautions are crucial. Brucella is transmitted through unpasteurized dairy and direct contact with infected livestock, especially goats, sheep, and cattle. It's common among veterinarians, farmers, and slaughterhouse workers. Brucella's main virulence factor is its ability to survive and replicate inside macrophages, evading immune clearance. This bug can localize in the reticuloendothelial system, organs with plenty of phagocytes like the liver, spleen, lymph nodes, and bone marrow, and cause granulomatous inflammation. Clinically, brucellosis presents as an undulant fever, typically rising in the afternoon and falling at night, along with malaise, weight loss, arthralgia, and hepatosplenomegaly. In some cases, it can progress to osteomyelitis or endocarditis. Diagnosis often involves blood cultures, which may take up to a week to become positive. Alternatives include agglutination, PCR, and ELISA. Agglutination detects anti-Brucella antibodies through clumping in serum. PCR amplifies Brucella DNA for rapid, specific identification. ELISA measures antibodies to confirm current or past infection. The illness tends to be prolonged and may relapse if not treated properly. Doxycycline with rifampin is the standard treatment for uncomplicated cases, often given for 6 weeks or more. Next is Francisella tularensis, a very small, fastidious species that stains faintly and requires cysteine-enriched media like chocolate agar or buffered charcoal yeast extract. It's a facultative intracellular pathogen and a potential bioterrorism agent, so biosafety level 3 precautions are necessary. Transmission typically occurs through rabbits, rodents, or deer ticks, with people working outdoors, such as hunters and landscapers, at higher risk. The most common form is ulceroglandular tularemia, where a small ulcer forms at the site of entry, often the hand or finger, followed by regional lymphadenopathy. Other forms include oculoglandular, pneumonic, and typhoidal tularemia. Francisella's key virulence factor is its ability to inhibit phagosome-lysosome fusion, allowing it to replicate inside macrophages. Culture is risky because it has a very low infectious dose, so diagnosis relies on serology or PCR. The disease can be serious if untreated, but responds well to streptomycin or gentamicin, with doxycycline as an alternative in milder cases. Last is Pasteurella multocida, a gram-negative, non-motile, oxidase-positive coccobacillus that grows well on blood agar, forming round, gray colonies. It's part of the normal oral flora of cats and dogs. Infection usually follows a bite or scratch from a household pet. It's a common cause of rapid-onset cellulitis, typically within 24 hours of injury. Deeper infections may lead to abscesses, tenosynovitis, or septic arthritis. Pasteurella's capsule and endotoxin help evade host defenses and promote inflammation. It's easily cultured and is indole positive, which helps distinguish it from other soft tissue pathogens. It's typically sensitive to penicillin, with amoxicillin clavulinate being the treatment of choice. In most cases, the illness is localized and responds quickly, but in immunocompromised patients, it can become invasive. Let's go back to our questions. What gram-negative coccobacillus infects farmers, veterinarians, and slaughterhouse workers? Answer: Brucella species. Which one causes soft tissue infection in pet owners? Answer: Pasteurella multocida. Which one produces painful skin ulcers with regional lymphadenopathy in hunters or landscapers? Answer: Francisella tularensis. Aced them all? You're on fire. If this video helps solidify your understanding of zoonotic gram-negative coccobacilli, hit like, share, and subscribe. Download the summary table in the description to review the key features of each species. Thanks for watching.